treatment platform, it does have 3 different treatment capabilities, but you guys in this office, we're really kind of utilizing just 2 of those treatment capabilities. So I am going to give an overview kind of what the entire device does, but we're really going to focus on the 2 treatments that you guys perform here in office. So we are FDA cleared for the removal of benign lesions. That's specific to the treatment that we actually don't offer here. But for the treatments that we do, you guys are FDA cleared to reduce inflammation, pain, swelling, FDA cleared to use dermabrasion when we're specifically using that microdermabrasion tip. We are FDA cleared for that. And we are also indicated to reduce thermal injury, so post-laser or really post any sort of dermatologic treatment that's creating acute inflammation, we are indicated to reduce that inflammation. And we'll talk a little bit about the word inflammation. I'll say it a lot, but we'll kind of get a little bit more into the weeds just so we're knowing what we're talking about. So again, this is kind of the same information, just displayed in a different way. So this is our 1 treatment platform, as you can see listed on the right of this PowerPoint slide. We do have 3 different treatment capabilities, and we do that through 2 mechanisms of action. So the first mechanism of action that we don't offer here is our freeze treatment. It uses freezing temperatures to remove benign lesions. You don't need to remember that. We're really going to focus on the second mechanism of action, which is where we're using cold temperatures. So we're kind of right above 0 degrees Celsius. We're using cold temperatures to downregulate inflammation, which means we're decreasing redness, we're decreasing swelling, we're improving the skin at that cellular level. And we're really working on acute, kind of that one-time stimulus inflammation, and also chronic inflammation where you're consistently being triggered and your body is producing that inflammation more chronically. So again, this is the same information, just displayed a little bit differently. We're kind of focusing on the bottom half of the slide here. So with our cold mechanism of action, we call it our global cryomodulation. That's just a fancy term for overall precision cooling, which means we're cooling a larger surface area. And with this mechanism of action, we have 2 treatment options that you guys offer here. The first is called our gloss treatment. It's our 4-step treatment where we're combining cold and the power of this machine with 4 different potent topicals. It includes a chemical peel, a microdermabrasion, a calming mask, and a moisturizer. And then we also have our glide treatment. So this is our 10-minute treatment. It's 1 step. 10 minutes kind of per the size of an outstretched hand, and we'll kind of go a little bit more in detail about those 2 different options. So the first half of this video, you don't really need to focus on. It's our treatment that we don't provide here. But in the second half, you can kind of see we have that applicator tip attached, and she's doing that gloss treatment. So for the 2 treatments that we use this device for, you're always going to have an applicator tip. So if you see on the handpiece here, we're always going to be attaching an applicator tip to this native 7mm handpiece. So again, kind of focusing on the left of this slide, it's really, these pictures really aren't showing you much other than there's a lot of inflammation in the skin. We're using cold to decrease that inflammation. We like to say cold has been around since the dawn of time. We're just utilizing it in a new way. We know that cold decreases inflammation. If you were to go outside and sprain your ankle, you're going to notice that it's getting swollen, it's getting hot, those vessels are dilating, blood is rushing in, that inflammatory cascade is working, it's in effect, and you're going to put ice on it and you're going to elevate it. So we know kind of theoretically that cold decreases inflammation. We just have a device that has specifically kind of targeted, used that idea, and produced a way to have clinical effects on our patient's skin in a way that we want. We want brighter skin, we want healthier skin, so we've just kind of used that idea and created the technology for it. Again, this is kind of pictures of the cells itself, but I really want to focus here on our contraindications and our considerations. So in selecting the patients that you're going to treat, our one only contraindication is a diagnosis of skin cancer to the area. This is specific to more of your gloss treatment. We don't want to mask signs of malignancy, so we just want to make sure that we're not treating over any sort of suspicious lesion or diagnosed malignancy. So if you are, working on a face where there's a little bit of unsureness, I would make sure that they go to a dermatologist, have it checked out, and then they can come back in for their treatments. Other things to consider, so this might not prevent you from treating your patient, but more so we say it's provider's discretion of whether or not you want to treat or how intensely you want to treat, is if they have acne or a history of acne scarring or recent use of Accutane. We know that Accutane thins the skin, so there are a little bit people that are on Accutane even up to 6 months after stopping Accutane, their skin tends to be a little bit thinner, a little bit more sensitive, especially with our gloss treatment where we're using some exfoliation, they're going to be a little bit more sensitive to the sun there. So just things to keep in mind. If they have an open wound or active infection in the treatment area, we don't want to spread around infection, so being cautious of that. Known history of skin allergies or sensitivities. I know for you guys, y'all had a patient that had a tree nut allergy and definitely had a reaction to this. I will say in our mask step, this is step 3 of the gloss. This is the same product that we use for our Glide, which is that 1-step 10-minute treatment. This does have shea butter in it, so just be cautious. If your patient does have an allergy to any of these topicals, and we can talk a little bit more about what's in each one in a second here, you can always interchange products that you know are safe for your patient. So if I know you guys offer that fire and ice facial, if a patient's coming in and they have a lot of sensitivities, you can do that fire portion, and then when they come in for the ice portion, which is that 10-minute glide treatment, you can use whatever product you know is safe for your patient, as long as it has glideability and cold durability, meaning it's not soaking into the skin too quickly. It's able to kind of sit on top of that skin so the handpiece can move around.
And with that, we have our gel mask. That would be nice because that's cooling.
Yeah.
You could also do our unscented jojoba facial oil because that's really lightweight too. But I would probably try to do the mask if you could.
Yep. Recent dermabrasion, laser, or skin resurfacing. So with our gloss treatment, again, this is that 4-step treatment. We are providing exfoliation. So I would say in between gloss treatments or in between gloss, if they were doing gloss and then lasers, you do want to wait that full skin cell cycle of 4 to 6 weeks to kind of let their skin heal before doing another gloss or another dermabrasion or another laser. With our Glide treatment, which is the 10-minute cold treatment, it is very benign. You could technically do it on your face every single day if you wanted to, and your skin would be so incredibly healthy. So with that treatment, because we're also FDA cleared to use it immediately post laser and immediately post some of those treatments, you can use that. You don't have to wait a full 4 weeks or 6 weeks to do that treatment again. Recent use of topical exfoliant. So whatever y'all's protocol is in terms of stopping retinols or retinoids prior to treatment, we ask that you use the same protocol with our gloss. So if you have patients stopping those 3 to 5 days prior to treatments, we just ask that you use the same protocol here for the gloss treatment. And then underlying cold sensitivities. So there are some patients that are allergic to cold. This might not be the great option for them. We have treated patients with Raynaud's, which is more of like a sensitivity to cold in the extremities. Because we're working on the face, sometimes patients with Raynaud's can kind of handle this treatment, but just being aware of what they're comfortable with and recognizing that this is a cold treatment. So moving into kind of the 2 different treatment options here. So we know that prolonged inflammation leads to premature aging. I like to say that we age, unfortunately, no matter what, but we're just trying to limit premature aging. We're trying to limit people looking older than maybe they are. I give the example of myself. I have Crohn's disease, which basically means I have chronic inflammation in my gut. So I have to be on medication that prevents that inflammation because inflammation over time anywhere in the body can lead to cell damage, it can lead to tissue change, and it's harmful. So same with our skin, prolonged inflammation is harmful. So we're going to talk a little bit about chronic inflammation and how it changes the structure of our skin and kind of degrades our skin over time. So again, when we're talking about inflammation, we have chronic inflammation, which is long-term inflammation. You have that consistent stimulus. Maybe you're outside, every day. Those UV rays are kind of your constant stimulus. Your body is constantly in inflammation cascade. And then we have acute inflammation, which is more of that one-time stimulus. They come in, they get a laser treatment, their body's immediately reacting. This is more so short-term. So kind of an overview of skinflammation. This is a word that we kind of coined to describe inflammation in the skin. So we have external activation. I'm just going to move on to this next slide here. We have activation. So again, we have those intrinsic factors to aging. We have a little bit less control over some of those intrinsic factors. That includes genetics, hormones, age. And then we have extrinsic factors to aging, or external factors to aging. These are things that we have a little bit more control over. UV is the number one extrinsic cause to aging. So we know that sun is not good for our skin. We've been in this industry long enough to know that. So we have UV, air pollution. If you live in a big city, that can actually affect inflammation in your skin. If you have lack of good sleep cycles, lack of nutrition, all of these things can kind of affect inflammation within your skin. And then once that DNA is being ruptured, once that inflammatory cascade is being activated, we have kind of a whole list of different things that kind of come into the area. We have different cell signaling, we have different enzymes coming into the area. Honestly, the inflammation cascade is such kind of a complex thing. I couldn't even tell you everything that's happening within our bodies, but I do want to talk about kind of how that's affecting our skin. So I love this picture, and I know you guys can't really see it. But when our body is being triggered, when that DNA is ruptured in the cells of our skin, and our body is kind of going into that inflammatory cascade, what happens is our blood vessels dilate, blood rushes into the area. You can kind of get redness as a visual representation of inflammation in the skin. We also have an enzyme called MMPs that come into the area, and it eats away our collagen and elastin to make way and to make room for more of those inflammatory markers and mediators. So when we are being stimulated more rapidly than we're able to repair, when our body is breaking down that collagen and elastin more rapidly than it's able to repair it because we're in the sun every single day, that is when you're going to get collagen and elastin degradation. And that's where you get kind of the visual appearance of fine lines and wrinkles. Another cell that we have within our epidermis is called our melanocyte cells. They produce melanin. When we are in the sun and being constantly triggered, those melanocyte cells are in overdrive. They're producing melanin to protect our skin, but as a result, we have dyspigmentation, we have sunspots, we have melasma, different types of skin conditions. The top layer of our skin, our stratum corneum, gets degraded and dull because our barrier function in the skin is reduced when we are constantly in that chronic inflammation, which leads to the visual appearance of dryness and dullness. One of our skin's functions is to regulate and retain moisture. So when that barrier function is being dysregulated, we're not able to retain moisture as well, which is how we kind of end up with dryness. So a lot of information on inflammation, but just wanted to kind of talk a little bit about kind of what that visually looks like in your patients. So it looks like redness, it looks like dullness, dryness, fine lines, wrinkles, laxity, uneven pigmentation. And I like to say, every person walking around planet Earth has some level of inflammation in their skin because we are outside and we are not always having the best nutrition and we are not always having the best sleep cycle. So I like to say that this device can be utilized on every single patient walking in your doors. Whether they already have something else scheduled, you could add on that 10-minute glide treatment, or if they're looking for that standalone treatment, this is a great option for them as well. We're really kind of working to help reduce the root cause. So by decreasing inflammation in the skin, you're having a positive effect on what those symptoms are, which is redness, fine lines, dyspigmentation. So again, we know that cold therapy has been used since the dawn of time. We're just utilizing it in a new way. So talking specifically about the glide treatment first. So this is our 10-minute cold treatment. It's one step. Again, it's used for acute inflammation, so post-laser or heat-based modalities, post-microneedling, post-injections. even post minor surgeries. So we have some plastic surgery offices that have this device in office. Once that incision is well approximated, it's somewhat healed to where you can introduce a topical on top of it, maybe a week post-surgery. You can use this to decrease the life of that hematoma, speed along the healing process. We have some practices that are using this post-blepharoplasty, so post upper and lower eyelid surgery. And then it's also great for chronic inflammation. So sometimes there are patients that come in and you're like, I would not touch your skin with a 10-foot pole because anything I do to your skin right now is gonna make it worse. You're so inflamed. Even if they're coming in with a sunburn, that's a great example of kind of a way that you can use the glide treatment too. So maybe you say, let's just decrease that inflammation first, come in once a week, let's just do the 10-minute treatment on your skin, and then once your inflammation is a little bit more calmed down, you can come back and maybe we can do the gloss treatment where we're adding in some exfoliation.
Can I ask a quick question?
Yeah.
So I've had a couple clients that have came in and they were pretty inflamed even when I did the first step, and I actually skipped the exfoliating step for them. So that is an option too. Like if you have a client that's on your bed and you see they are inflamed even after that first peel step, I would just, and so I've skipped it, or I've just done one pass with that micro tip, and I don't do circular motions, just really lightly just to get a little bit of exfoliation. But yeah, I mean, I've skipped that before if they were just
I had a
too
client
much.
too who had very like mature skin, a lot of like sagging, and I didn't feel really comfortable using the exfoliation step either, just because it just felt like it could have like
Too
just
much.
caused some like micro tears or something. So I skipped it too.
And that is when, so for our protocol with what we do for the cryo gloss, the full 50-minute, after you do that exfoliation step is when you would do like your manual extractions if needed. Okay, so that, just so they know.
Yeah, so that's a great use of provider discretion. You are looking at your patient's skin, you get to decide what you feel like they can or can't handle, and you can always customize this device. So you can skip through steps if you need to, and we'll talk even a little bit about once we're actually doing the treatment, how to do that and how to, I mean, it's easy. You just press the fast forward button, but there are two big blinking buttons. One's an X and one's a fast forward.
Don't press the X.
Okay, so just really quickly, step by step, each of the different treatment options has a treatment card that goes with it. So that's kind of a part of our consumables. So for the glide treatment, we have a glide card. It has 40 treatments on it. If you ever need to, figure out how many treatments are left, once you insert the card, there's a little number on the bottom left-hand screen that will tell you. And sorry, I don't have it pulled up. That will tell you, and then you'll know how many treatments are left. But there's 40 10-minute treatments. We want you guys to treat 10 minutes per the size of an outstretched hand. So if you're treating someone's face and neck, you can use this anywhere on the body. We ask that you do 2 10-minute treatments. So you do like 10 minutes, treat the entire face, and then you could do 10 minutes on the neck, treat the entire neck. I'll get to that in a second. But basically, we're trying to achieve cumulative cooling. We want the tissue to be as cold as possible for as long as possible, so we don't want to spread out that cold timer over too large of a surface area to where we're really not down-regulating inflammation to the extent that we're trying to. So the first thing that we're going to do is we're going to insert that treatment card. We're going to prep our patient's face. We'll go ahead and clean it off. We'll put the product on their face that we're trying, that we're using. If they don't have a tree nut allergy, you can always use the product that we provide, which is our niacinamide snow algae mask. This is more so for chronic inflammation. So if they're just coming in and you're just doing the 10 minutes, if you're treating them post laser or microneedling, you can actually use whatever post-procedure product you typically put on their skin and use that as the gliding force. And I prefer that you guys do that because this product has not been tested on compromised skin. Niacinamide can be a little bit reactive to some patients, so I think it's probably better to use your own post-procedure product if you're using this for acute inflammation.
And for us, we're not, that would be more med spa, so yeah. But they will feel a little bit of a bite too, you know what I mean, with that,
Yeah.
Amanda, can I just ask a question?
Yeah.
Because I know Angel had a patient that had pretty severe rosacea, just very inflamed, lots of inflammation. Would you recommend on somebody who is that inflamed to maybe use a substitute product instead of our mask because of the niacinamide?
I would.
Okay.
Yeah. I would use whatever, like the most benign product that you have. Then we're going to attach our applicator tip. So I'm gonna grab this box. So this is actually our demo gloss kit box. You guys don't have the boxes.
Do you guys still have boxes at Springfield or no? Okay, yeah, we don't either. Here, we have all the back bars out.
This is more for COVID. They kind of take up a lot of real estate, so we moved to the back bar. But for the glide, you're gonna attach your smooth tip. So if you guys see in the very small, there's a very small canal. There's like the bottom of the tip, but there's a very small canal inside. That is where you're gonna place your hydrogel. So we have a gel right here. It's 95% water. We say that this is our conductor. So it's conducting the cold from the handpiece to now this applicator tip. So you're gonna put a tiny bit of hydrogel inside that narrow canal. Then you're gonna press it up, attach it. As long as you use pressure, that's good enough. You're not gonna hear it click. It's gonna feel like it's not attached. It is if you apply pressure. Then it's going to display a banner on the screen. You're just going to tap the banner. You're going to pick up the handpiece and you're going to press the blue button on the handpiece, and that's going to start your 10-minute timer. So that's kind of the whole step, the whole one step that you do for this glide treatment.
And for the newer SDs who are just learning this, can you talk about the importance of it always goes face down?
Yes. Yeah. So if you guys see on the handpiece, you have this, I don't even know what this is called, clip. It's larger at the bottom and more narrow at the top, so you always insert it tip down. It actually won't even go in if you try to insert it tip
But it will break, like,
yeah, but the
snap
clip
off,
could snap off, yeah. So also anytime you're moving the device, just try not to move it from this, because this will clip off, really just the handles in the back. We'll go over housekeeping in a second. Kind of treatment techniques and pearls. If you're treating a face, we're breaking the face up into 3 sections. So those 3 sections are the right side of the face, that includes the right chin, right upper lip, right side of the nose. Left side of the face includes the left chin, left upper lip, left side of the nose, and then the forehead is that last section. So if you're doing 10 minutes on someone's face, you might do 4 minutes on one side, do the entire 4 minutes on one side, move to the left, do the entire 4 minutes on the left, and then maybe 2 minutes on the forehead. The reason for that is we want to, again, achieve cumulative cooling. We want the tissue to be as cold as possible for as long as possible. If we were to treat the whole face at one time, this tissue might start to re-warm by the time we got back to it. So we really just want to keep it cold, 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 and then move on to a different area. Kind of like, well, it's different than working out, but when you do work out, you do your entire leg, you do all of the motions on that one leg before you move to another leg. Other techniques, we'll kind of show you. I think it's easier to see because it's the same technique for glide and gloss, and that you're breaking the face up into 3 sections. The reason you can spend a little bit less time on the forehead than the 2 sides of the face is because there's less subcutaneous tissue up there. It cools down a little bit faster. And actually, if you were to spend too much time up there, it can start to feel like a brain freeze. If it ever does feel too cold for your patient, if you move the handpiece a little bit faster, it feels less cold. If you go slower, it feels a little bit more cold. However amount of time you spend on one side of the face, just make sure that you spend the same amount on the other side of the face, because we want to treat the face consistently. And we'll kind of talk about some of these treatment pearls too when I'm actually demonstrating it, because I think sometimes when you're explaining step by step how to do something, it feels like when someone's explaining a board game to you and your mind is just like swirling and you're like, I can't focus and pay attention. So sometimes it's easier to just kind of see the demonstration. But if you guys do follow the blue dot on this face, this is kind of showing what motion we want you to perform with this. The blue dot is going to show more of a bullseye formation, and that she's outlining the entire side of the face and then almost coloring in the cheeks. That's one way to do it. You can also do kind of long concentric motions, moving chin to cheek. If you do move chin to cheek, I just ask that you start back down at the chin and move chin to cheek. If you were to do it like this and then down, you're kind of inconsistently cooling the tissue. We want to make sure that we're having that systematic approach to cold. And then treatment recommendations. So you could do, we always recommend a series that's supported by our clinical research, a series of 3 or more. For the glide, you could space it a week apart. Again, they could come in every day if they wanted. But for patient schedules and time constraints and financial constraints, you could do once a week or every 2 weeks, or even once a month. That only is kind of what works for their schedule. But I will say for chronic inflammation, a series is always going to yield the best results because they are kind of consistently being triggered. You want to kind of do a series of treatments. And then for our gloss treatment, so we're just going to talk about it a little bit and then I will demonstrate it. So if your mind is swirling, don't worry because you'll actually get to see it. For our gloss treatment, so in our kit, you're going to have your smooth tip, your microdermabrasion tip, so this is tip number 2, and then you're going to have 4 different topicals. So we have our microchemical peel, our probiotic mist. This is basically just kind of the gliding force for tip number 2. You only use tip number 2 with step number 2. So for 75% of the treatment, you're using that smooth tip. Then we have our snow algae niacinamide mask. This is the one that does have the shea butter in it. And then our moisturizer. This is our tripeptide rich moisturizer. And we'll talk a little bit more about the ingredients in each one. I just want you guys to kind of know and see what the steps are.